After every sentence you write, you need to think, but why? You don't have to read a book. I feel like everyone tells you, read a book, read When Breath Becomes Air. I did not read a single book. Everything you're writing, all the research that you're putting in here, make sure that it sounds nice. Make sure you also know what it means. Hi guys, welcome back to my channel, and in today's video, I thought I would share with you the medicine personal statement that got me interviews at King's College London, Cambridge, and Glasgow University. For all three of these unis, I got through to the interview stage, and interviews are something I'll talk about in a later video. But for today, I wanted to read my personal statement out to you guys and also give you the same tips and advice that were given to me. Now, disclaimer, by no means am I saying I have the perfect personal statement. I've literally not read this since sending off my application, so this will be a fun read. My personal statement was 3997 characters out of the possible 4,000, so I literally went up to the mark. And before reading it, I do just want to say the advice I was given is because I was aiming for Cambridge, I was told make it 90% supercurricular and 10% about you. So that's why as I'm reading this, it might be like, whoa, but just a little pre-warning. That's the advice that was given to me, and that's the advice that helped, because I was told unis now less and less care about who you are in terms of, oh, I play piano, I like running, and they care more about I've done this, and this, and that's why I want to do this degree. So, little disclaimer before I start reading. I am fascinated by solving problems. This led me to want to pursue medicine, as utilizing innovations in science can pave the way to cure the previously incurable and save millions of lives. Following a sequence of steps to prove a hypothesis in a chemistry practical, or monitoring a patient through diagnosis, treatment, and recovery are both ways in which I can push the boundaries of my knowledge to reach an ideal conclusion. Medicine will enable me to cross the barrier between theory and practice, applying results from breakthroughs in the medical space to solve challenges that patients may face. To delve further into medical developments, I attended a Cambridge masterclass on skin and learnt about the importance of Langer lines in reducing scarring on healed skin tissue after surgical incisions. Intrigued, I researched into the breakthroughs in surgery and compared two wound transplant cases, the first ever wound transplant in the UK and another in Sweden. I learnt that in the UK, the procedure was an open surgery, starting with an infraumbilical midline incision on the recipient of the patient, whereas in Sweden, the procedure was performed laparoscopically, not requiring an open surgery stage. This led me to assess which technique was preferable, concluding that laparoscopic surgery may be better for the patient as there is less damage caused to surrounding tissue, reducing scarring and recovery time. My research allowed me to review the need to optimize treatments for patients and to constantly improve the healthcare that patients receive. To develop my understanding of the process a patient experiences following a surgical procedure, I shadowed a radiologist and physiotherapist during a work experience placement. During this, I witnessed a multidisciplinary team, MDT, work together in order to care for a patient. Following a hip replacement surgery, the physiotherapy team aided a patient in regaining good mobility and helped them prepare for living at home. This allowed me to identify how crucial acting with compassion towards a patient was, in order to build a trusted relationship between the physiotherapist and the patient. In conjunction, a HBL X-ray of the patient was taken post-surgery to check the procedure was successful. After seeing the teamwork within the MDT, it highlighted the need for the patient to be well informed before any decisions were made to enable the patient to use their autonomy. I observed the healthcare professionals act out of beneficence towards each patient they treated, ensuring the patient came first and received the highest quality of treatment possible. Inspired by the factor of patient well-being when deciding the course of treatment, I was able to take part in the Brilliant Club, in which I wrote a university-level essay on cancer treatments. Within my essay, one of the main focuses was the targeted chemotherapy drug imatinib, tyrosine kinase inhibitor. Despite an advantageous survival rate of 83% after 10 years, the multiple side effects such as muscle joint pain and edemas proved costly for the physical and mental well-being of patients. This led me to question if amendments to treatments could be made to lessen the negative effects on patient welfare. In my search, I read an article about the innovative subcutaneous cancer injection atezolizumab, previously administered intravenously, which could cut treatment times by 75%. Through the new method, patient welfare was improved as the difficulty caused when finding veins was avoided. With a responsibility for the well-being of others, my role as head girl allowed me to develop excellent listening and communication skills. Similarly, during my part-time job tutoring young children with SEN, I learnt to tailor my approach to each child to cater to their needs. Studying medicine will be rigorous, yet the gratification of combining my knowledge with medical advancements in order to treat a patient will be incomparably rewarding. That's the end of my personal statement. I've never had to read that out loud. So some of those words, wow, some of those words really. But the thing is, I know what everything in my personal statement means and is, and that's one thing I will say to you, because that was told to me. When I went into my interviews, I knew everything I have written in this inside out. The infraumbilical midline incision, I literally, if you asked me to do it right now, I could do it on a patient because I knew it inside out. I knew what layers of skin that incision had to cut through in order to access the uterus. Like, you need to know what you've written about. And that's my first bit of advice. Make sure everything you're writing, all the research that you're putting in here, make sure that it sounds nice. Make sure you also know what it means. So the structure of my personal statement, I did my opening, which is where I explain why I want to do medicine. This was my problem solving. I like problem solving. I like putting theory into practice. That was my premise. Then I talk about my research, my own personal research I've done, talk about my work experience, then I talk about Brilliant Club where I looked at cancer treatments. But what I've done throughout this is I've said why I wanted to do something and then what I did. So I've not even just said, oh, I had a Cambridge masterclass. I've said to delve further into medical development. So I've said why I wanted to do it in the first place. So I wanted to do something, so I did the masterclass, and then I said what I learned. Then I said, intrigued, I researched into breakthroughs in surgery and compared two womb transplant cases. So now I've said I wanted to do something, so I did this thing. After doing this thing, it then made me want to do this thing because I was intrigued by this thing. From this, I then learned X, Y, Z. So do you see what I mean? Every single sentence I've written, I've then gone on to say, and this made me do this, and this made me do this, and this that made me do this. Something I was told, and I'm going to say it to you, after every sentence you need to write, but why? But why? Every sentence you write, you need to write, but why? Why did I do this masterclass? What did I learn from it? Why did I like learning that about it? Why did I then go in to look at something else? Why? Why is the, after every sentence you write, you need to think, but why? If it's not answering a why, it should be a why. My middle paragraph, so when I talk about my work experience, that paragraph was basically chucking those keywords. I mentioned MDT, I mentioned autonomy, I mentioned beneficence, because these are keywords that they're going to want to see when they're reading your personal statement, especially for med. They're going to want to know you know these keywords, you know these key things that you're going to have to know as a doctor. Right, I had to switch locations, but we're still going. Another thing I do want to say, you don't have to read a book. I feel like everyone tells you, read a book, read When Breath Becomes Air. I did not read a single book. And I'm saying this now, write about things that you are passionate about and things you actually want to do. I referenced so many scientific materials throughout my personal statement. I referenced so many articles. I referenced bits of research that I had done. I knew what medical journals I had got those from. I did not sit and read a book when I had mocks coming up. I had med interviews coming up. I was trying to get my personal statement finished. At the same time, you're adjusting to year 13. There's so much going on. I was also applying to school in America at the same time. I did not have the time to sit and read a book. And in all complete honesty, I didn't really want to sit and read a book. So I didn't read a book. And I feel like that is the one thing I hear so much in personal statements. You have to read a book. You have to read a book. You don't. Read what you want to read. I wanted to read articles about the things that I mentioned. I sat and read an article that was published in a journal, a scientific journal. That was good enough for me. So I'm just going to say this now. You don't have to read When Breath Becomes Air if you don't want to. Not saying the book isn't interesting, because it is something I would want to read. But where I was so in my Grey's Anatomy phase, because I started watching Grey's Anatomy the summer I was writing my personal statement. So I feel like I'd already had exposure to dealing with patient losses and the kind of grief and trauma that I've heard that books talks about. So I was like, really, truly, do I want to read this book? Not right now. Because the mind frame I was in and the mind frame you're going to be in right now, if you're trying to get your personal statement done at the start of year 13, is not going to be, you're not going to have the time to sit and read a full book. And what I would say is, don't read half a book. Don't just read one chapter and think you can write about it. If you're reading the book, you have to commit to reading the whole book. That's why I'm going to tell you now. If you don't want to read it, if you don't have the time to read it, if you don't have the means to read it, don't read a book and don't write about a book. Because you can do just fine without ever referencing a book. Now, one thing I will say, my personal statement is very scientific heavy, and a point to note is that everything I've written about is things that I'm genuinely interested in. As I said, I was watching Grey's Anatomy. I was so interested in surgery. This time last year, I wanted to be a surgeon. I'm not saying it's completely written off right now, but I have my eyes open to other specialties in medicine. But make sure what you're writing about are things that you are passionate about. Because when you get to the interview and they start asking you about why you wrote XYZ, you will then know, I wrote about this because I actually love it. And you'll be able to talk about it, and they will see that genuine love as you're talking about these really complicated scientific things that you may have written about. So make sure every word you write is something you do care about. Hence why as well, don't force yourself to read a book, because if you don't really care about the book, it's going to be obvious that you just did it for your personal statement. Everything I've written about is things that I didn't actually do for my personal statement. I genuinely did these things in my own time because I was actually passionate about them, and then I was able to translate that into my personal statement and rephrase it how it needed to be phrased. I didn't go out of my way to do things specifically because, oh, got to write about this in my personal statement. No. And that's one thing I would also say avoid doing, because if it's not something you're genuinely passionate about, medicine in general, if it's not something you're genuinely passionate about, they will be able to tell by a personal statement. I also do want to note, throughout the whole of my personal statement, I did not say the word passionate. I did not say the word passionate once. I said I want to delve further into things. I was intrigued. I was inspired. Don't use the word passionate. If you can write your whole personal statement without saying the word passionate, you have done a good thing. So try and avoid using the word passionate. Think of synonyms. I use so many in my personal statement. Feel free to skim through and take any phrases that you want to use, like my sentence starters. If you need any help, drop me down a comment, especially if you're doing medicine, dentistry or vet and you're applying early. But yeah, if you guys haven't got the memo by now, I'm posting every single day. So I will see you tomorrow with another video. Thank you for watching. Like, comment, share and subscribe.